Parents who have obese kids should have their children taken away by the government. That is the gist of Dr. David Ludwig's argument, seen in the most recent issue of the Journal of the American Medical Association. KXLY4's Colleen O'Brien spoke to people in Spokane about this opinion piece. One thing is for sure, people are united in the fight against childhood obesity. Colleen?
That's really the point of this. Everybody I talked to agreed that something has to be done about kids, whether it be getting them outside to play more. Everybody, whether they agreed with the government involvement or not, thought we have to do something about childhood obesity. According to the Centers for Disease Control, 17% or 12.5 million children and teens are obese. That's triple the rate since the 80s. And a doctor in Boston wants government action. He writes, in severe instances of childhood obesity, removal from the home may be justifiable from a legal standpoint because of imminent health risks and the parent's chronic failure to address medical problems. Dr. Ludwig's concerns stem from his 400-pound patient that, by the age of 12, developed type 2 diabetes, sleep apnea, and high blood pressure. Reviews of his controversial piece are mixed.
It is shocking to me that the government would get involved. I don't feel like that's really their place to do that.
Kelsey Boyce has 2 kids of her own and believes it's ultimately up to the parents.
School nutrition programs, those kind of things probably should be the extent of it, I think.
John Cherrick, a doctor, has seen the obesity epidemic firsthand.
I think there are situations where the childhood obesity could fall into the same realm of abuse.
Mark Bierbauer agrees.
You can't allow a child to remain in a home that is a dangerous environment.
But his wife, Eleanor, thinks money spent on government intervention and court costs could be put to better use.
And of course, I'm not a big fan of the television for children too much when they're young. I think we all need to be more active and eat more healthily.
So what of Dr. Ludwig's patient, a 400-pound 12-year-old? She was taken away from her parents, put in foster care, and put on a regimen of 3 square meals and moderate exercise. She lost over 100 pounds. So here we have 2 sides of the coin. Some people think the parents are responsible. Any government action should come in the form of education for the parents and the children, while others say it's basically child abuse and the children should be taken away from their parents. In Spokane, Colleen O'Brien, KXLY4 HD News.